Common causes of groin problems. Here is a more detailed look at the causes illustrated above. 1. Muscle and tendon injuries, most common. This is often referred to as a groin strain or a pulled groin. What it is: a tear or overstretching of the muscles of the inner thigh, the adductor muscles, adductor longus, brevis, magnus, gracilis, and pectineus. Cause: sudden change in direction, kicking, sprinting, or overuse. Symptoms: pain in the inner thigh, tenderness, pain when squeezing legs together, and sometimes bruising. 2. Hernias. A hernia occurs when an organ or fatty tissue squeezes through a weak spot in a surrounding muscle or connective tissue. Inguinal hernia, most common. What it is: a part of the intestine or abdominal tissue pushes through a weak spot in the lower abdominal wall, often into the inguinal canal. Symptoms: a visible bulge in the groin or scrotum, more noticeable when coughing or standing, a heavy or dragging sensation, and aching pain. Femoral hernia, less common. What it is: more common in women, this occurs when tissue pushes through a weak spot in the passage that holds the femoral artery and vein, the femoral canal. Symptoms: similar to an inguinal hernia, but the bulge may appear lower. 3. Sports hernia, athletic pubalgia. What it is: this is not a true hernia, no visible bulge. It is a tear or strain of the soft tissues, tendons, ligaments, in the lower abdomen or groin area, where the abdominal muscles attach to the pubic bone. Cause: repetitive twisting and turning movements common in sports like soccer, hockey, and rugby. Symptoms: deep groin pain that comes on gradually, worsens with sports activities, especially cutting movements, and is relieved with rest. 4. Bone and joint problems. Hip osteoarthritis. Wear and tear arthritis of the hip joint can cause pain that is often felt in the groin area. Hip labral tear. A tear in the ring of cartilage, the labrum, that follows the outside rim of the hip joint socket. Pain is often felt as a sharp, catching sensation in the groin. Stress fracture. A small crack in the femur, thigh bone, often in the femoral neck. Common in runners and military recruits. Causes a deep, aching pain in the groin or front of the thigh. 5. Other medical causes. Kidney stones. A stone passing from the kidney to the bladder can cause severe, sharp pain that radiates from the flank, back/side, to the groin. Infections. Epididymitis/orchitis. Infection of the testicle or the tube at the back of the testicle, causing groin pain and swelling. Urinary tract infections. UTIs can sometimes cause groin discomfort. Swollen lymph nodes. Lymphadenopathy nodes in the groin can swell due to infection, inflammation, or, rarely, more serious conditions like lymphoma. Nerve compression. Pinching of nerves like the obturator nerve or the ilioinguinal nerve can cause burning or shooting pain in the groin. When to see a doctor. You should seek medical attention if you experience a lump or bulge in the groin or scrotum, possible hernia. Severe, sudden pain that prevents walking. Pain accompanied by fever, chills, or redness/swelling, signs of infection. Pain that radiates from your back or is accompanied by blood in your urine, possible kidney stone. Groin pain in a child or infant. Pain that doesn't improve with rest, ice, and over-the-counter pain relievers after a few days. Diagnosis and treatment. Diagnosis. A doctor will perform a physical exam and ask about your activities. They may also order imaging tests like an X-ray, ultrasound, or MRI to confirm the diagnosis. Treatment. This depends entirely on the cause. Strains, rest, ice, compression, elevation, rice. Physical therapy. Hernias. Often requires surgical repair. Arthritis/labral tears. Physical therapy, injections, and sometimes surgery. Infections. Antibiotics. In short, groin problems can range from a simple muscle pull that heals on its own to conditions requiring medical intervention. Getting an accurate diagnosis is key to effective treatment.